But let me show you this beautiful study. 155 living donors were assessed before giving their livers. And look at how interesting. The right lobe is almost twice or more than twice as big as the left lobe. So 66 to 33% in volume. So if you're draining a patient who has a tight stricture at the bifurcation and you can only drain the right side, you are safe because you can drain more than 50% of that liver. Interestingly, as you can see here, sometimes you may only be able to drain the anterior segment and maybe the left lobe, but not the posterior segment. But you see that draining the anterior segment and the left lobe will result in a drainage of about 70%. So this is something very important to consider